Good. How are you?
Good things.
This is so exciting. I feel like we've been communicating for the past 5 years or so, and we've never actually, I mean, we're not really face to face, but it's the closest face to face we'll get from across the coast, right?
Yeah, exactly. It's a face to face these days.
Yeah, that's all that matters.
Definitely.
First of all, can you hear me all right with audio? Does everything sound
Yep,
good?
it sounds great.
Awesome. Well, Dr. Warsh, I'm really excited to have you on today. I was just thinking last night, I was like, of all the questions I need to ask him, I was scrolling through your Instagram. You have such great content.
Thank
But just for listeners, so Dr. Warsh represents what is actually becoming a more mainstream path in healthcare. And that is as someone who went the conventional route, then decided to pursue a more integrative approach in their practice. So I always like to kick off the conversation, Dr. Warsh, and asking how you found yourself in the integrative medicine space and what really prompted that transition for you.
Yeah, it's a great question. I think for a lot of practitioners who go into the integrative space, it's a personal journey of some sort of health issue that they've been through, and then the medical system kind of failed them or didn't do what they needed, and so they kind of got into integrative medicine that way. That wasn't me. I luckily, knock on wood, always been pretty healthy. I think for me, it was more a frustration with the regular system, kind of seeing throughout my training just how few options there were for patients except for medications. I had seen so many patients or be aware of like friends, family members, whatever, going outside of the medical system and then getting better after things they had issues with for years. And it's like, wow, like what's going on here? And my wife's also pretty holistic minded, so meeting her also, kind of pushed me in that direction as well. It was kind of all those things together, but it really overall was seeing people get better and being like, well, what is this? Like, what am I missing? What else can I
Yeah.
add to my tool belt? And why is somebody who has an autoimmune condition who goes to the doctor and gets medication and so this is for life, and then they go to a naturopath or whatever, and then they get better, and I don't know. It's like, well, okay, what's going on? What are they doing? That's what led me to learn
Yeah.
about it.
Well, clearly you did an incredible job of piecing those puzzle pieces together, right? And really delving in on your own and not necessarily just accepting what you learned in school, right? And you had a post a while back, I recall, and it really stuck with me because I loved it so much. But it was basically you holding a board. And I feel like that's your quintessential style, right? Your signature. And it essentially said, as an integrative pediatrician, my most common prescriptions are one, do nothing, two, natural remedies, and then like number 99 was Western medicine. So I'm just curious, what is the breakdown, maybe like general percentage wise, of each of those approaches that you use in practice?
It's so interesting because I think for me, I have a very unique set of like a unique timeline of working in a regular practice and working in a regular hospital and kind of going through all of that and seeing when I used to work there, when I wasn't very integrative minded, how frequently I would do prescriptions, right? Or how frequently prescriptions were given around me. It was like I didn't need to look anything up because I knew it off by heart because you would give a prescription so frequently. And then when you start to learn about other options, you realize how infrequently you need to do it. And now I have to look stuff up every time just to make, mostly every time, like some of the basic ones I still know. But like if you're doing anything, it's like you have to look it up now because you so infrequently do a prescription. Like it might be once a week or once a month where I'll do a prescription as opposed to, once every few hours or once every hour when you're in the hospital setting or the clinical setting where it's just normal. Because parents want you to do
Yeah.
something. Their kids are sick, and when you can't do anything, that makes them upset. And they're like, oh, my kid's sick. And you're like, okay, it's just fine. But the reality is your body does take care of these things most of the time. And yes, we need to be there to identify if something is serious because sometimes you need a medicine. Sometimes you have a bad pneumonia and, an antibiotic will save your life or whatever it is. And that's fine. But that's just not the case 99% of the time. It's usually a virus. It's usually going to get better. And the best thing that you can do is not pump yourself full of medicines and weaken your immune system more. It's just let your body do what it's supposed to do. And if you want to do anything, then give your body the nutrients that it needs to support your immune system and help your body fight off whatever is going on. And so that's what I usually do. And so a lot of times it's either do nothing or try these things first, and then if it's not getting better, let me know. But one of the big keys there, which is very helpful for me in my practice setting in a private practice is I can trust my patients to reach out to me, and that's a big part of it, right? Because if you don't do anything and things get worse, they have to reach back out, right? Because sometimes you would need a medicine, but I'm pretty comfortable with my patients that if I say, okay, it looks okay, but just reach out to me in case it's getting worse, then they will. They're like, oh, the breathing's getting a lot worse now, and that may be a time where you do need a medicine. So communication is also kind of key when it comes to this stuff too.
Yeah, no, that makes sense. And I always like to preface too to just my audience in general and stating that there is a time to use conventional medicine, as you alluded to. And in my opinion, it's for either like acute illnesses, right, or injuries, but not necessarily more like chronic, autoimmune type disorders, etc. But I am curious, what specific situations do you opt to use conventional medicine? At what point would you encourage that parent to maybe consider suppressing that fever? Because I know that's a whole other area that, we share a similar sentiment on that, but I'm just curious, like,
Sure.
where do you draw the line?
So it's really weighing the pros and the cons. And when it comes to using a medication, is there going to be a good benefit from this medicine? And if you feel like there's a bacterial infection that's getting worse, then that's the time to do an antibiotic. It's the decision point is, do I think this is viral or bacterial? If you have a pneumonia, a bacterial pneumonia, you do antibiotics every time because that's going to heal you. If you have a cough or a cold or a virus, upper respiratory infection, then you usually shouldn't do antibiotics unless it's turning bacterial. So that's really the key differentiation point is, do I feel like this is bacterial or do I feel like this is viral? And you can play the odds at first in general, and the odds are if it's mild, if they have a low grade fever, if they're otherwise okay, they're still drinking, they're still happy, for a normal older kid, then it's probably viral and you can treat it as such at the beginning. If it gets worse, if the fever lasts more than 5 days, if they're having very high fevers like 105, if they're very sick appearing, if they're having trouble breathing, all of these will be indicators that it's something more serious. But that's not very common. It's not very often. Most of the time it's the mild symptoms. And so it's looking to see the progression towards those things, or to seeing a parent that's very, very concerned because this is way outside of normal and, they're debating going to the hospital or not. But that's when you should be doing medicine, when it's like, I want to keep you out of the hospital, not I don't feel good for a day. How many times have you been sick? And it's like, you rest, you don't feel great,
Yeah.
get some fluids, and then you get better in 3 days.
Yeah, no, exactly. And also, too, that just reminded me, there was this book I read, I want to say 2 or so years ago, when I first started getting into homeopathy, and it's called How to Raise a Healthy Child in Spite of Your Doctor, by Dr. Robert Mendelsohn. Does that sound familiar to you?
Yeah.
Yeah. So basically, for listeners, he's this like renowned pediatrician who basically advises parents on a lot of home treatment, right, for like many childhood illnesses. And one thing he says in particular is that like the greatest threat of childhood disease lies in like the ineffectual efforts made to prevent them, through mass immunization. And his whole like argument is that it's been so aggressively marketed and it's now considered the bread and butter of pediatric practice. So what is your take on immunization? And I know this is obviously a very, very broad topic. There's a
Mm-hmm.
lot of nuance, but overall, what is your take on that?
Yeah, I take a balanced approach. For me personally, I think that I'm a big fan, a big proponent of personal choice, and I think people should be able to choose whatever they think makes the most sense for their own family. I, you know, Vaccines have done a lot over the years in terms of, prevention of diseases, and they have a very good theoretical purpose, right? And I don't think anybody is opposed to, you get something beforehand, it protects you from the disease, saves your life, and you don't have any side effects. I don't think anybody's against that theory. The question is, what kind of side effects come from taking any sort of medication? What are the risks? And I think that's where we need to do a lot more research over the years. I think that it's unfortunate that these days it's like do it or don't do it, and there's not a lot of discussion about, can we make it better? Should we have a discussion around it? Should we think about, are there things that we don't need as much anymore because the disease patterns have changed? It's just kind of a, very divisive topic, and it doesn't need to be.
Very.
Most people want good information, and I think that a lot of good information does not exist that's in the middle. I think you have like, the CDC stuff, and then you have the woo-woo stuff,
Yep.
and then there's not a lot in the middle. And I found from my practice that a lot of people are in the middle, and they're not opposed to it in any way. They just want good information. And I think that it's really hard to have the right information when you're getting that from companies. Right? I think that's the biggest flaw in the system at the moment, is that we need independent research on these for people that are unbiased, so that way we can figure out exactly what the pros and the cons are, what the risks are, and then try to minimize those risks as much as possible. Everything you do is going to have risks. There's no question. You take a medicine, you take some Tylenol, there's a risk to that, and you're weighing the pros and the cons for yourself. And so that, to me, is I think where a lot of the frustration lies. Is I think people have lost a lot of faith in the medical system because it's not a discussion these days. It's more of like, just do it. And I think there are certainly some pros to doing it. There are a lot of diseases that really are not around very much anymore, that you get in a room with a bunch of kids, and the ones that have been vaccinated are protected against, and other kids could get pretty sick. And some of these diseases could make you very sick. They could. But that doesn't negate the fact that we shouldn't have a good weight of the pros and the cons for each kid, and then make decisions based on that. And I don't think that's happening enough these days.
Yeah. And to that point about finding reputable research, do you have any like sources that you recommend parents check out? Obviously, aside from like going directly to PubMed, which again, you still can't necessarily trust, right? There's so many other factors to a study, who it's sponsored by, et cetera. But do you have any like just go-to trusted resources that you could recommend?
It's hard because the information that a lot of parents are asking for doesn't exist, because the research has been done by the companies for the most part. So you can certainly, like, some people read the vaccine friendly plan. There's stuff in there. Dr. Green Mom has a lot of good resources on her website. The Those are like the big, like, there isn't, they're just I think that, like, for those questions, there isn't the information because it just doesn't exist. Not really, right? I mean, you can certainly go to the CDC website and look at what they have, from a science perspective. I mean, I made a vaccine guide. It's on my website, raisingamazingplus.com. You can download it for free, and I tried to go through the CDC website and the sciencey websites and kind of pick out the information from that aspect, in terms of, like, well, what are the risks and how many kids have gotten this in the last few years, and those kinds of things, because that information exists. I mean, you can see
Yeah.
the kind of negative aspects of the diseases, but in terms of the risks from anything else, it doesn't really exist, because the companies do the research. They do it for a few days or a few months, and that's it. And then there's nobody really rechecking it. And it's also, it's tough because it's very hard to do anything long term, because if you take, I don't know, let's say an antibiotic today, and then you get cancer 10 years from now, it's really hard to be like, okay, that antibiotic caused cancer, right? It's a really tough thing to do. So, hopefully over time, then people will do more research and be open to it. But I think we're missing that piece to really refine what we're stating. And also, there's been nothing done on everything together. And that's another, I think, big concern for a lot of parents. Is like, okay, you can look at, and even if you do have some research on a specific medicine, well, what is that doing in terms of everything together? Like, if you're doing a bunch of medicines and a bunch of shots, and, like, how does that work together? Do all of those have some negative effects long term, or they don't? And I think people would be more encouraged to do things the more research there was that was unbiased. And that's where I think it's just really unfortunate the medical system is not doing that, because it's like, okay, if you really want to encourage something, then do the research, show it over and over again, do it in an unbiased way, and then people, they'll see that and they'll be like, oh, okay, well, they've actually studied it properly, and then I feel more comfortable doing it. And I think that's a problem, because people always ask me, like, where's the research? And I don't know. I mean, if it exists, I don't know it.
Yeah. Question for you though. So you alluded before, you mentioned, like, yeah, someone takes an antibiotic and then gets cancer 10 years later. Like, you can't necessarily draw the connection, but I am curious of your take on this dramatic increase in autoimmune disease that we're seeing today among children, also kind of coinciding with an increase in either vaccinations or, again, like the use of antibiotics. Like, what is the connection there, if any, that you've seen?
Yeah, my personal opinion is the reason we're seeing this increase in chronic disease, autoimmune disease, is food and toxins. So I think our food is terrible. It's getting worse and worse and worse. We're not getting the nutrients that we need, and we're literally built of what we eat. And if we're getting food that's devoid of nutrients, then our immune systems are weakened over time, and we just don't have the building blocks that we need to stay healthy over the long run. And eventually, we run into a problem our body just can't handle anymore. And that's why 50% or more of kids have a chronic disease these days. I think it's, you just don't have the building blocks that you need. Plus, you add in all the toxins, and it's not any one thing. I think it's everything together. I mean, it's the air that we breathe, the water that we drink, the toxins that are sprayed in food, stuff that's sprayed in our clothes. It's all of it together. And so you have this assault on your body in terms of toxins, and then a lack of nutrients. And at some point, it catches up with you. And I think we're hitting that point more frequently these days because there's more chemicals and less nutrition. And so kids have more autoimmune disease, autism, ADHD, whatever it is. And there are many reasons for each thing. There's not one reason for anything. But I think it's that, like, those two spheres kind of coming together to a point that it's too much for most people. And that's where the integrative medicine comes in, and why I think a lot of people get better when they go to an integrative practitioner. It's not because they do some voodoo magic. It's because they change up their lifestyle and they start eating better, and they get better nutrients, and they give them, supplements to support what they might be missing. And maybe they start becoming more mindful of the things that they're purchasing. And then you decrease the toxic load a little bit, you increase the nutrients a little bit, and their body starts to be able to figure out what it needs to stay in that healthy zone. So I think that's what we're seeing, is that, just a lot of kids without nutrients that they need and filled with chemicals.
Yeah, going back to the basics, right? And I am curious, Dr. Warsh, did you receive any nutrition education as like you were pursuing your actual medical degree? I've heard that within those 4 years, students are lucky if they receive even like 2 weeks of nutrition education. Is that true?
Yeah, it's very minimal. So nutrition, at least when I was there, it was more focused on disease. So like nutritional deficiencies. So if you're low in vitamin B12, this is what you should look for. If you're low in folate, this is what you should look for. That's most of the nutrition counseling. It's not very focused on healthy eating, healthy diet. You learn a little bit about like carbohydrates. You learn like the basics and the chemistry and that kind of stuff, but it's not a discussion about wellness and health and healthy eating. I don't know if that's changed. I think that it has changed somewhat. It's definitely not a lot, but I'm quite confident that it's more. It is a little bit more known that it's important. So I do think they have a little bit more in training now, but basically nothing still. Because I don't think that the medical system has really come around to the fact that it's so important yet. And to some degree, I mean, I think that it's never probably going to be in the scope of doctors' work to really counsel on that, because they don't have the time, I think. And what I hope is that the medical establishment realizes that it's very important, and then partners up with nutritionists a little bit more, and kind of, I guess, acknowledges how important it is, and then includes that in the training in whatever way it's possible, whether that's online training, whether that's working with nurses or whatever, but just talking about it more. I can't see any world in any time in the near future where a doctor's going to spend an hour talking about nutrition. They don't have that kind of time. And I don't think that's probably even the best use of a doctor's time. I think it's important that doctors acknowledge that and then work in a team, and have people that spend their whole life learning about nutrition and teaching it. But I do think if we were taught more about nutrition in the right way, then it would be more top of mind, and then doctors would take it more seriously and realize that, like, okay, I have my patient with this stuff, I need to get them to a nutritionist to change up their diet. I think that's the key differentiator, which isn't happening.
No, I couldn't agree more. And I am curious, what's your general opinion on optimal nutrition for children? So we hear all of these different things, right? Again, the diet space is it's so divisive, but I've heard a lot of folks, I spoke with a few recently on like autoimmune disorders, for example, and they've recommended completely getting rid of gluten and dairy from the diet. So it's interesting because you work with children, right? And it's obviously a lot more challenging to, give guidance for a child's diet for so many different reasons. So what's your take on that?
Yeah, and optimal is to have real food, right? I think our food is so crappy to begin with that if you want optimal, let's live on a farm or near a farm and eat fresh food that was just picked that day. That's not practical, right? I mean, obviously I know that, but that's what's going to be best, because you're actually going to be eating food that was farmed in the correct way, that wasn't mass produced, that has all the nutrients that it's supposed to have, that goes through the proper cycle, and you're eating it fresh whenever it's supposed to be there. Anything that you're getting from the store, I don't care what it is. It still had to be picked early. Still had to be shipped across the country or shipped to wherever. You still have to get it. It's going to be a couple of days later. If you pick something off a tree like a berry, you have like 2 or 3 days it goes bad. So whatever we're getting, it's sprayed in something. Always. It's never like perfect, no matter where you go, no matter how much you want to spend. And so yes, you want to get the best food that you can. But if you're saying what's optimal diet, that's the most optimal. Then realistically, in the real world, you have to get them fresh fruits and veggies. You have to get them food that you're making yourself most of the time. Anything that's prepackaged has a lot of preservatives, has a lot of long chemical words that you don't know what it is. Those things are worse for you than having real food. So optimally, you're giving them real food, whatever that is. Most kids don't do well with gluten and dairy, so I don't have a problem if people don't do it or minimize it. I think if you're fine with it, that's fine. But the way that we make our gluten and our wheat is pretty crappy in America. The way that we treat our cows here in the milk, they're injected with hormones and a lot of antibiotics, and they're mass produced in farms and all those kinds of things. So I think our dairy is just not that great also. Not that you couldn't have dairy. I just think that the version that we have at this point is so mass produced that it's causing a lot of problems for people. And so at the end of the day, if your kids are okay with it, I think that's fine. But there are so many kids that aren't. So it's always a good place to start if your kids are having issues, to remove those or at least minimize them down, so they're not getting a ton of it. And then just focus on actual foods. I mean, there is no diet that kids should be having. They should just be eating real food, and you should be cooking it and preparing it and making it yourself and using products that have words that you actually know. If you do that, you're probably 95% of the way there, and that's going to work just fine for most people. And if you want to move out to a commune and live on a farm, I mean, so be it. But that's not going to happen. But people do. I mean, I know people that they were sick and they moved, to Costa Rica, or they moved to Hawaii or whatever, and they get better because they start eating fresh food.
Yeah.
I
Can you
think.
just touch on, no, I agree. Can you just touch on for listeners too, like again, why gluten in the US might not be the best? I mean, I've heard it's binary, right? It's not pure gluten, which is why when folks travel to other countries like Europe, they can consume it without issue.
Yeah, a lot of our products are sprayed in chemicals, right? So whether it's glyphosate, so weed killers and pesticides, those kinds of things. I mean, they're all sprayed in something for the most part. Most things are sprayed in glyphosate or sprayed in something similar. They're also, a lot of our food's been genetically modified. So they modified it so that it can withstand the pesticides. So basically, they're okay to get sprayed the stuff that should kill it, and then you're eating it. It's fortified with things. I've heard a lot of people have issues with folate that's added to it. So that is an issue. I think it's just the way that it's prepared. It's not made in the old fashioned way where it's milled and processed and again, I think it's not necessarily the wheat or the gluten. I think that's part of it, but I think it's mostly the way that we make it, the stuff that we spray on it. That's all a part of our wheat and dairy, and so that it's so filled with chemicals and so different than it used to be that it doesn't sit well for most people.
Yeah. No, that makes sense. So we obviously touched on the importance of nutrition, obviously toxins in the environment. What are some other small changes that obviously have significant impacts in the long run that parents out there today can prioritize to improve their family's health?
Yeah, I call it the seeds of health or the foundations of health, being stress, environment and toxins, exercise, diet, and sleep. So just kind of going back and going through those for a minute. So I always ask, like, what's the number one change that you can make for your health? And I think it's reading labels. I think reading the labels for everything that you buy is a really easy, simple change. Doesn't cost you anything and can make a huge difference. Because if you turn things over and you look at the ingredients, and you're like, oh, I don't want any of that blah 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 whatever. I don't even know what it is. And then you buy the thing that actually says apple, like apples, or almonds or whatever, then you're like 90% of the way there already. And that doesn't cost you a cent. It doesn't have to be more expensive to buy healthier food. You don't have to go from chips to broccoli. You can buy a healthier bag of chips with better ingredients, and at least you're going to have lower sugar and less salt and some better ingredients in there, and your kids will still be happy. But you're moving in a better direction if you change that, and then you buy one other thing that's a little healthier, and then it's like, one bag of chips is not going to do you in, but 10-15 years of bad food choices will. And that's what happens when people get sick. So if you start changing those food choices and making them a little bit better, then your body's going to be healthier. So I think like that's my number one tip. Making sure that kids are getting sleep is super important. That's where you detoxify. That's where you rest. That's where you grow. And toxins, we talked about that a lot. So again, being mindful of the things that you're purchasing and realizing that, you know, everything you put in your home, your kids are exposed to all
Yeah.
day or all night. So you don't want to have the Wi-Fi router right by their head. You don't want to have everything sprayed in flame retardants. You don't want
Yeah.
to be. You want to make sure that you clean out your ducts because maybe there's, you know, mold or a lot of dust in there when you're turning on your air conditioner or your
Yeah.
heater. Like those kind of things can make a big difference in terms of even just breathing, right? If you're breathing many times every minute, then or many times every minute, then if the air is a little bit cleaner, if you have plants in your house, well, that's going to help decrease your toxic load.
Yeah. And quick question for you too on that front, Dr. Warsh. I mean, we see all of these companies coming up now, right? Creating like absolutely zero VOC furniture and
Mm-hmm.
which is wonderful, right? But it's incredibly expensive.
Mm-hmm.
So for people out there who again like can't afford to buy a $5,000 organic couch, you know, I mean you mentioned plants, but like what are some other basic practices that they can do to make sure that their home is clean, is non-toxic, like air purifiers, like
Mm-hmm.
what are some other things they could do?
Yeah, I think the first thing to know is that, you know, not every healthy couch is going to be super expensive, right? I think you got to do your research, and certainly some things are more expensive, but not necessarily. A lot of options out there these days are not necessarily a lot more expensive, if more expensive at all. So I think that's the number one thing is it's the mind setting of trying to find the healthiest product that's within your price range. And it's not to say that you need to do everything or buy everything that's super expensive, but if you're mindful of the toxins, then you'll look for the best, cheapest version of the thing that you're comfortable getting. And it may not be the $5,000 one, it may be the $1,000 one, but maybe the $1,000 one is 10 times better than the other $1,000 one that you were going to buy that had chemicals. So it doesn't have to be the more expensive one, it just is the better, lower chemical one. And maybe sometimes that's going to be a little bit more expensive. Sometimes it won't be, but the price you pay for health. I mean, there are some things that we just have to bite the bullet, and you do your best that you can. But you know, if you want food that's not sprayed in chemicals, it might be a little bit more expensive. And if you can afford it, then what a better place to spend your money than on your health. But not everybody can for everything. So I think like an air purifier is very good. You can have plants in your home. That purify the air. You can get a filter for your water to filter out if you're drinking tap water. Um, yeah, I think those are
Even
the
cleaning,
big.
even cleaning solutions, right?
Oh
Just
yeah,
like opt to
exactly.
use
Yeah,
white
you can make your
vinegar,
own.
right?
Yeah, a lot of
Exactly.
people want to go and spending by the 99% killing antibacterial whatever, and you could just get water and vinegar, water, baking soda, and maybe essential oils, and do that, and that can cover you for most of your cleaning. And again, it's like we talk about things being more expensive, but that's way cheaper, right? There are
Yeah.
things you can do that are way cheaper that are going to be better for your health, and you can still have the thing that has chemicals for when you need it if there's some kind of specific spills, but you don't need it most of the time.
Yeah. Not to go down a rabbit hole, Dr. Warsh, but that just also sparked another question I had. So I recently came across a study that showed that, I forget where it was done, in Sweden or some European country, that basically showed that children who were raised in homes that had a dishwasher in which like the plates were like again washed very thoroughly, high heat, had worse like how do I say it? Would get sicker and had like worse microbiome health than their peers who grew up like in a home in which the parents hand washed
Mm-hmm.
everything, to
Mm-hmm.
the point of why like bacteria is actually really healthy for us. It's healthy for children, it's healthy in gut development. And I think today too there's so many people who over sanitize
Mm-hmm.
thinking that they're protecting their children, but it's often to their detriment.
Mm-hmm. Yeah. So I don't know that specific study, but I know lots of studies similar. So I'm sure that makes a lot of sense because it's kind of the hygiene hypothesis is what it's called, and over sanitation is not necessarily a good thing. There's a level of sanitation that is important, but we are made up of bacteria. Our guts are full of bacteria, and we have been trained over the years to fear bacteria, and for good reason sometimes. I mean, it can make you really sick, but most of it's not bad for you. Most of it's very good for you. And if you're mucking up insides and sanitizing everything beyond what's reasonable, then you're not actually being exposed to the good bacteria that you're supposed to be exposed to, and then that makes you probably more susceptible to getting sick. I've seen it on farms. There's farm studies where the kids on farms have lower rates of eczema and allergies and asthma versus kids in the city. I mean, those were the landmark studies. I don't remember when they were done, but
Or even people with dogs too.
all these things. So, I mean, you also think about it like think about doctors, right? Doctors should be getting sick every day all the time. We're literally taking care of sick people. We're in their face, right? Like looking in your throat when you're sick, and yet like your doctor's not away every week,
Yeah.
right? So there's something to be said about being exposed to things. And obviously, you don't want to go lick doorknobs and things like that. But at the same time, cleaning stuff too much is also bad for you. So you just want to clean reasonably. And my assumption based on the study that you're mentioning is, if you're using the over chemically soaps and things like that on your dishes all the time, then you're probably consuming some of that. It probably stays on your plates, and you're getting rid of the natural world that's on there, and so you're ingesting chemicals, and that probably throws off your insides too, and makes your gut less healthy. So it doesn't mean you shouldn't use a dishwasher. I just think again, it's like use natural soaps, use it when you want, use it when you can. Think about what you're putting in there, because there are a lot of really not natural soaps that you put in your dishwasher.
Yep. Absolutely. No, couldn't agree more. So we veered off a bit, but going back to some of your other top tips in terms of small changes that have significant impact that parents can make.
Oh yeah,
I think
we did environmental exercise. So that's a big thing, I think. I mean, everybody knows exercise is important. It's not rocket science, but especially with the pandemic, being inside, we forgot about how important it is. Kids got off of their routine of being in being involved in activities, sports, dance, whatever. And we have to get back to that. We have to encourage it even more so these days because of computers and technology. I'm not against technology. I just think that whenever you're doing something, you have to think about what you're not, or what they're not doing. And if they're in front of a screen all day, then they're not exercising. So we have to be very mindful to make sure that they're getting appropriate exercise, getting appropriate sunlight. Everybody's vitamin D deficient these days because nobody's outside enough. And we're so afraid of the sun and skin cancer and all these things. But at the same time, the sun is also important for us too. So it's a balance. And you test people, and it's like 40% of people are very deficient in vitamin D. So it means we gotta get outside more. We have to exercise more, and that's a huge part of our immune system as well. So that's a free tip. Just go outside for a walk a couple times a day, and that'll get you a long way. And then stress is the last one. I mean, we're very stressed. Social media sucks. It's very bad for our health.
Yep.
These days, for the most part, the news is very bad for our health. It's all doom and gloom. So I think it's really important that we're very mindful of that. If you're going to use social media, which is it's a part of the world, so if you are, then like craft your feeds to be more happy. Again, you don't have to have people on there that are all doom and gloom. Craft out times of the day where you're not checking your phone. If you're scrolling for too long, turn it down. Don't have it beside yourself in the bed, so you're not scrolling all night and not sleeping. Don't check it first thing when you wake up in the morning, so that you start your day with stress. All these things are free, simple things that you can do that can help your immune system and decrease your chance of getting sick. It's
so
not
basic.
It's just basic. It's all basic, but I mean, the people that do these things are healthier. It's pretty simple.
Yeah, absolutely. And I am curious, Dr. Warsh, have you seen a rise in terms of like anxiety cases in younger children over the past years? And I'm assuming that's related to technology. I'm curious of your take on that.
I think it's in part technology. I think it's life. Life these days. I mean, parents are more anxious, so they have more anxious kids. There's a lot more going on. We have a lot. I think we have a lot more access to things. So the anxiety level because of technology is a big problem. I mean, it's great that we have information. I think that's great, right? There's a lot of good that comes from social media and technology, but the bad is just really bad. I mean, there are lots of studies that are coming out these days about social media and the increased risk. If the younger you are, the more increased you have of suicide and mental health disorders. And it's again, that's not rocket science either. It's like if you're sitting there scrolling through all the horrible things that are happening in the world, then you're going to be more stressed. And there were always bad things that happened, but you didn't necessarily need to know about every single one of them. You don't need to know what's going on in Australia today, all the time, right? It's like there are things that you want to be aware of, but then there's being too aware. And I think we're way too aware because we think the world is coming to an end and it's the worst era and it's all doom and gloom. And if you really step back and look at the world, then we're probably in a much better place than we were 1,000 years ago. You probably have a lot lower risk of dying tomorrow right now than you did when people were like, when the Vikings were like coming around and, doing those kind of things, or when
Absolutely.
diseases would just, you would like bang your toe and then you get an infection and die because they didn't have antibiotics.
Yeah.
Like, we have a lot more technology, a lot more knowledge, and it's a much safer world overall. And so it's our perception, not the reality. Yes, there are lots of bad things that are happening, but we also just have access to them, so it just seems like a lot more bad stuff is happening. But that's not really true if you really step back. So I think that sometimes is important, and just like realizing we're so small in the universe and our stresses are important to us, but yet they're not any different than, or not any more than people have always had. Everyone has stress about whatever. And sometimes if you can just step back a little bit, then it helps you to get some perspective, and that can help you to move forward.
That's so true. Yeah, I'm over here just sitting and nodding because I preach that to myself on a daily basis. But in terms of like your prescription for younger children who come in with increased anxiety or depression, I mean, I'm assuming it's like a combination of what you've already touched on. But is there anything specifically that you would really advocate for in those cases? Obviously, rather than putting someone on, a very young child on an antidepressant or what other conventional doctors might do.
Sure, sure. It depends on the severity, right? I mean, sometimes it's very severe, and in that case, you would maybe need a medicine, like if they're suicidal or something like that. But that's not usually the case. So if we're talking about normal, air quotes, normal anxiety, I think that, well, number one, getting them connected with a good therapist or somebody that they trust so they can talk to kind of work through their anxiety, work on strategies. I think that is extremely key, because finding a good partner that you can work through can be really helpful for kids and teens. And there's some stigma around getting mental health help, I guess. But
Mhm.
a lot of times when you're going to a therapist, especially as a kid, you're not sitting on a couch, like you see in the movies. It's more going through strategies of okay, when you get nervous, here's some things that you can do. Here's how you can color your way through it. Here's how you can talk about it. Here's some breathing techniques, whatever it is. So I think that's number one, the key. And then number two is exercise. Exercise over and over again is proven to be more effective for anxiety and stress than medications. Just is not necessarily in like the extreme case, but for your average anxiety, it works better than any pill that we have. And so just trying to encourage people to exercise every day, that's a big key.
Yeah, absolutely. I love the natural substitutes. Even too, I read something recently that said saffron, the spice saffron, in a
Mm-hmm.
clinical trial, Dr. Warsh was actually shown to be as effective as the antidepressant citalopram, which was
Mm-hmm.
just mind blowing to me, right? So like there's so many natural alternatives again that people can use without necessarily having to go the medication route.
Right. And to me, and this is what I talk about a lot, is what's the harm? Like, why not try? Whether you're going to be on a medication or not, if a natural remedy doesn't have side effects for you and does help you, and it lowers the amount of medication that you need, gets you off of medication, prevents you from needing to be on a medication, why would a doctor not want? Why would a patient not want the most natural, least risky thing that's going to help them? And it doesn't mean that you shouldn't be on a medication, but why wouldn't you try the natural thing first if there's no severe, urgent issue going on? Why wouldn't you try it with it? Why would you not want to try to decrease your? There's no logical reason that
Yeah.
you would not do that. Why would you want side effects? Nobody wants that. So no
Yeah.
doctor wants it. What does doctor want? They want you to get better. They want you to be healthy. And so it's so frustrating sometimes that it's like natural versus medical. It's like there's no
I
difference.
know.
It's like
It's
it's
all
whatever
medicine.
works. It's all medicine.
Whatever
It's
works.
whatever works, and whatever helps that patient get better. Within reason. And yes, if you have a very depressed patient who's suicidal and you give them lavender, that might not be the right thing to do for that patient at that time, right? They might need a medicine. There's nothing wrong with that, but there's also nothing wrong with giving most people some lavender. Right? It's like that's going to have lower risk than your medicine. And if you give them lavender and that's what they need and they don't need a medicine, what is the problem with that?
Yeah. Exactly. I couldn't agree. I couldn't agree more. I mean, what's this like the thing that all doctors swear by? It's like to do no harm,
Oh, the
right?
Hippocratic
Like they
Oath, yeah.
thank you. Yeah. So how many actually stick by that? But to the point about just like behaviorally, so like let's say a patient goes to their doctor, they discovered, I don't know, some new natural remedy that might help them in lieu of whatever medication the doctor might want to put them on. And the doctor feels challenged, right? Like I've experienced cases where whether it was for myself or for my mom, where I'll present the doctor with some type of complementary therapy and they're very dismissive of it,
Mm-hmm.
right? Or I'll how do you deal with a doctor in that mindset?
Yeah, I get that question a lot. That's actually why I created the natural parenting course I have on Raising Amazing Plus. It's like it has that like specific stuff in there because there's no easy answer to like how do you deal with a very Western doctor, but there are some strategies that you can take. I think the number one strategy is you try to figure this out before, right? You try to find a doctor that um, is open to having these discussions and does have some similar belief to what you have or doesn't poo poo the things that you say. It's not always possible, but I think you can save yourself a lot of trouble and heartache if you can find a doctor that you can have these discussions with. If you can't, then you have a couple of options. I mean, you can get a second practitioner that you can work with. So you can talk to your doctor about it, make sure that there's no interactions, make sure that they don't have any major issues with it. They might not be totally all for it, but they might not be against it. They'll say, I don't know much about it, but it seems like it's okay. Because sometimes things can be, even if it's natural, it could be dangerous for
Yeah.
you. So I think it's important to still discuss anything that you're taking, but you can work with a naturopath too. So you can work with both, and a lot of people do. They work with two practitioners, and that way they can discuss these items. And then if you really want to talk to a doctor and they're kind of open to it, then you bring them research and data to the best of your ability. Not I was on this Facebook mommy group and this person said this. The doctor's not going to listen to you then. But if you say, well, I was looking through and I found a couple studies that show that elderberry syrup really does seem to be helpful for coughs. Like, what do you think? Do you have an issue with it? If you bring it up in that way, then you're at least
Yeah.
speaking their language, and they're not going to roll their eyes at you. So it just kind of depends on how you present it. But realistically, if you're going to go the natural route, then you need to find a doctor that's at least open to it. And there are lots of doctors that are, and things are moving in that direction. Medicine's slow, but the younger generation, especially of doctors, is much more open to this stuff. Um, and
Yeah.
I see it every day. People reach out to me, and they're like, "Oh, I saw that you're a doctor and you're doing it. Like, where can I learn about this a little bit more? I'm really interested. This is kind of cool." Because really, anybody that has their eyes open would be interested in it. Doctors are not bad people, right? They're there to help you, and if you can give a doctor data on something that will work better and have lower side effects, they'll do it. It's just the problem for natural remedies is there isn't data for most of it. Not the same because it's not a pharmaceutical company, so it doesn't exist, and so it makes it hard to recommend something that doesn't have really good data behind it. But I think doctors are starting to recognize that medicine is not the answer for everything because people are so sick, and so
Yeah.
they're a little more open these days, seemingly, to discussing these things. And also, more and more people are using it. And so, I don't care who you are, how hardcore of a doctor you are. If you see your patient get better and you didn't do it, you're going to be curious as to what happened. If you are a cardiologist and you're like, all right, well, you need to take this medicine for the rest of your life because your cholesterol is going to be high, and then you come back 3 months later and your cholesterol is down, they're going to be wondering what you did. And if you took some natural remedy, they're going to look into that. They just will.
Exactly.
So
And we've seen that too. I mean, there's so many like what would have been considered like woo woo or alternative, I don't know, like several decades ago are now being more integrated into
mhm.
mainstream medicine, right? Like acupuncture being one of them.
Acupuncture. Yeah,
That's
exactly.
that's a staple.
Yeah, I
And
talk
I
about all
mean,
the
there's
time.
so many, yeah.
Yeah, because it's like it takes such a big problem to create this kind of solution, but you have an opioid epidemic. They need solutions. Acupuncture works. It's always worked. If you work with a good practitioner, it really works well. And there's no side effects, not really, from acupuncture, and there's huge side effects from opioids. So
Yep.
let's find a solution that's not that. Well, acupuncture is one of those options, and so yeah, that's made its way in, and doctors are like, oh, okay, well, if acupuncture is pretty good, then maybe some other herbs will be good, right? So I
Exactly.
think with each step you get a little closer to some sort of molding, but it's hard because we don't learn this stuff. And most doctors are not going to be open to learning it. And again, they're not going to be open to prescribing something that doesn't have clinical trials. And most of this stuff doesn't have that.
Yeah. I think the key, and not only for doctors, but for everyone in life, is to be a constant learner,
Mm-hmm.
right? Like
Yeah.
you're always learning. And I'm just curious too, how do you stay informed about the latest developments in, both conventional and integrative pediatric
Just
medicine?
reading and just being in part of groups and things and just seeing things come up and then continuing to read and learn. There's no easy way. I mean, there's no like integrative pediatrics book, not really, right? I mean, there are some ones out there, but
You
it's
should start one.
yeah, maybe I will, but they exist. But again, there's no data, right? So it's like there is like
Yeah.
the holistic pediatrician, Dr. Kathy Kemper wrote it. It's really good. She's like the head of the Harvard program. So like there are things, but the most part, it's like okay, well you should take this, but there's not a lot of evidence on it. It's like what really needs to happen is there needs to be money, a lot of money put aside to do clinical trials on a lot of these things. But who's going to do that? You need
Well,
billions.
yeah. One day.
One
One
day
day,
maybe
Dr. Warsh.
we can
One
dream.
day. We can dream. Well, this has been such a wonderful conversation. I do want to be conscious of your time because I know you're a very busy person. But where can listeners find you?
Sure, you can find me at easiest places on Instagram. I'd say Dr. Joel Gator. You can find me on Raising Amazing Plus. That's where I have the courses and master classes. Lots of free stuff there. And then there's a vaccine course, natural parenting course, pregnancy course, a couple of things there. I also have supplements called Tiny Roots, Apothecary, stuff for vaccines, stuff for immune support, all that kind of stuff. So you can find that on my Instagram too. Yeah, Instagram is usually where people find me.
Wonderful. I will include the links to all of those in the show notes. And yeah, I'm a huge fan of your Instagram account. It's honestly one of my favorites to follow. You post, first of all, such just incredible information, but also really, really like funny things. Like there was something you did the other day. It was a picture of an ultrasound, and the mom was like, when my child didn't complain about what I was eating, like just really funny cartoons that you post. So I really appreciate all of that. But my
Thanks.
last question for you, Dr. Warsh, is what does being well and strong mean to you?
I think it means having a healthy lifestyle. I think it means eating well, getting good rest, exercising, decreasing your toxins, and just being happy in general, being healthy. I think that we forget how important it is just to be healthy, and our health is such a problem these days that it's like we're accepting being sick. We're accepting our kids being sick. We're accepting 50% of kids having a chronic disease, and that's not well and strong. I think well and strong is doing the basics, living a lifestyle that promotes health, and then actually being healthy and enjoying life, being out in nature, and creating a community of happiness. So that to me is well and strong.
I love that. Beautiful. Well, Dr. Warsh, it was such a pleasure to finally see you and speak with you. Hopefully, one day we'll actually have a chance to meet in person. But thank you again for all the incredible work that you do in this space. And I'm really excited to share this with listeners.
Thank you. Thank you for everything that you do as well.